Welcome to the Fabulous at 50 podcast, where we are changing the aging narrative. I'm your host, Joanne Newduck, and I'm thrilled to bring you stories that matter and celebrate your place in the world. As an advocate for lifelong learning, health, and women's empowerment, I believe it's never too late to live the life you've always imagined. Through lively and informative interviews with inspiring guests, we'll explore a wide range of topics relevant to our global sisterhood of vibrant, inquiring women just like you. Join me for today's episode, and let's start changing the aging narrative together. Welcome to today's podcast, everyone. I have an incredible guest on here, and we are going to have a very important conversation, and a conversation around healthcare and women, and how sometimes there's a bit of a disconnect here. So before I bring Susan on, I just want to share a little bit more about her. Of course, you'll be able to see her bio in the show notes. So Susan Salenger is an author and researcher behind the book Sidelined: How Women Can Navigate a Broken Healthcare System. Sideline examines the many ways in which some women manage and sometimes mismanage their healthcare. Susan explores how women, typically the medical gatekeepers of their family, tend to be extremely conscientious about taking care of themselves, yet at the same time inadvertently undermine their own care. They often hesitate to call the doctor when they don't feel well, or they worry that their doctor visit will take time away from their family and their work. They may hesitate to ask doctors the necessary questions and don't always comply with the doctor's instructions. So, Susan's research reveals how conflicted many women are about the medical decisions they ultimately make. And so today we're going to have a really good conversation about that. But a little bit about Susan. She was born and raised in Los Angeles, and she attended UCLA to study English. After graduation, she worked alongside her husband, Fred, for 25 years at their production company, Salenger Films, which produced corporate training and development films distributed worldwide. Today, at age 81, Susan lives in North California to be near her incredible family, which includes her 2 daughters, 4 grandchildren, a cat named Max, and a dog named JD. I love that. When she's not speaking about her book or spending time with family and friends, you will find Susan powerlifting to stay in shape. So Susan, welcome. You have such an incredible background, and it's begging the question for me is, can you share a little bit about how you went from working 25 years with your husband in the film industry, and now you've written a book and you're helping to empower women to navigate their healthcare? How does one go from that to this? What happened? There must be something between those 2 dots.
Well, there was, but it was kind of a journey, an unexpected journey, I guess you would say. Years and years and years ago, when I was in my 30s or even my early 40s, I agreed to have some unnecessary surgery. I say unnecessary because I knew I didn't need it, but the doctor insisted on doing some exploratory surgery, and I agreed. I got frightened, and not only did I agree, even though I thought he was wrong, but I insisted it be done sooner rather than later. All right, so I had the surgery, everything was fine. It turned out I was right. I didn't need it. I just went back on some old medication and everything was fine. But I was ashamed of myself, and I was just really surprised that I had made that decision. It's not like me at all to do that. All right, so, I had 2 young kids. Life goes on. I forgot about it. Fred and I were in the film business and we worked together. But after 25 years, we sold the business and I decided to retire. And that lasted for, 2 seconds, maybe 3. It didn't work at all.
I've only known you for like half an hour, and I can tell you were such a go-getter. All right. But then it sounds like there was a hiccup. What happened?
Yes, it was really. I thought I was I don't know what I thought of. I didn't think. Let's just leave it at that. So I decided, just again, to make a long story short, my family said if I didn't go do something, they were going to kill me because I was bugging everybody because I was so bored. So I went back to
Mm.
school and I was planning actually to get a doctorate either in English or psych. I truly didn't know which because I've always been interested in both. And I just went like to extension. I wanted to take a couple of English classes, English lit classes. I wanted to take a couple of psych classes, but they were both full and I couldn't get in even as an undergraduate class. I mean, it was, they're popular majors. So I ended up in anthropology just because it was the only thing that was available other than accounting, engineering, which I couldn't have cared less about. So in the anthropology class, it turned out I love anthropology. I had no idea. I had never taken it as a kid. And I ended up somehow in medical anthropology classes. One of the
Oh,
teachers there
interesting.
sort of became a mentor, one of the professors, and it was interesting. And so for one of those classes, I mean, I told you it's a long story. For one of those classes, I did a project with women who had had hysterectomies. And some of them had agreed to
Okay.
that surgery, even though they didn't think they needed it. In fact, one woman was
Okay.
positive she didn't need it. She was positive her symptoms were just menopause. The doctor
Mm.
disagreed anyway, so she had the hysterectomy. So that, of course, reminded me of my original issue, which was that I had and I thought to myself, how do we as women make our medical decisions? I mean, here I agreed to have surgery. I didn't need hers was irreversible. I mean, mine was just a blip. Hers, you can't, scotch tape your uterus back in. Um,
Wow.
so I really interviewed about 50 or 60 more women and with different diseases. And I did that on purpose because I was interested in the behavior. I wasn't interested in the particular disease. I wanted to know if there were underlying behavioral traits that as women we share when we're ill. And sure enough, there were.
Okay.
And so,
So let me just clarify, when you were interviewing them, was this part of your studies or was this
no,
now your concept that you wanted to write a book?
correct. After I interviewed the few women with the hysterectomies, I thought to myself, my question was, how do we make our decisions? And the only way to answer that was to do some research because I could see some similarities in the women I interviewed for the hysterectomy. But then I wanted more women because, you never know. I didn't know these women I'd never met them before. So maybe their answers were off the wall. I mean, I had no idea. It was only just a few women. So I really wanted to know what women as sort of as a group think, although of course we're all
Yeah.
different. But so I did interview, I think 50, 60 women, which is a substantial number,
Yes.
and found many traits that we all share in common when we're ill, regardless of the particular disease. So that was
Interesting.
sort
And
of
what
the
what
journey to
what
the
are
book.
those? Yeah, and is
Well, the
that's
first
what's
one that,
reflected in the book? What's a couple that
I'm
come to
sorry, you
mind
froze
that
again.
surprised you?
I'm losing you. I'm so
Oh,
sorry.
sorry. Um, what what are some of the traits that you found like surprised you?
That come to mind.
Yeah.
Well, I think one of the ones that surprised me was that women put themselves last. Because I mean, we go to the
Mm,
doctor more often than men. We're diligent about our health care. But yet, when something's wrong, we take care of ourselves last. Women do
mm,
80% of the caretaking in the world, not just in your country or mine, but in the world.
yeah.
And so it was shocking to me that we put ourselves last. There was a study done um, where researchers gave women I think it was five things to prioritize. What would they put for who would they take care of first? And the first thing everybody said they would take care of was their children, of course. Then their
Yeah.
pets, which I loved. That I mean, that's second, believe it or not. Then
Oh,
they had to take care of their elderly parents. And as an elderly parent, I did not like being third, I have to tell you. But anyway, and then fourth, they take care of their
maybe
significant
you should
others.
rank above
Yeah,
pets,
yeah.
perhaps.
Yeah, I certainly would have put elderly parents first, but I have a narrow perspective. I agree. But then, last but not least, they take care of themselves. And even the airlines tells you, put on your own mask before you put on your child's. So you can't take care of everybody else when if you feel like crap,
Absolutely.
it's not going to work. You're
Exactly.
in a
Well,
yeah.
as you know, with Fabulous at 50, of course, any of the programs or any of the messaging that we have, it's so vital that we give from our overflow. Like one of the things that I keep
Right.
sharing is that our taking care of ourselves, that term self-care is not selfish. It's vital
Right. It
because
is
we are no
vital.
good to anyone. We end up being
Right.
a burden, which is what most women don't want to be if we don't
Exactly.
care, take for ourselves first
Yes.
and then give from that overflow. And I must admit, it's a lesson I've learned certainly in the last decade or so. And
Yeah.
we really do. We show up in the world and we can share so much more when we do that.
Mhm. Mhm.
Um, so what are you finding? Like, so you had these interviews and you're seeing these commonalities. Like, where did that lead you? Like, was it suddenly like, I need to write a book on this? Like, what was the main messaging you wanted to get out
Yeah.
there based on this knowledge you had?
Well, one of the things I learned two things before I wrote the book. One, when I was in the anthropology classes, academics write for each other. And a lot of this wonderful medical information that I really thought women needed to know was not getting out there because I've always followed medicine. I've always been interested in it. And there's some really good stuff about how women get the short end of the stick frequently, at least in our country. I don't know in yours. Um, and I
Yeah,
thought,
there's
gee,
some
that's a
issues here.
sure. And I'm not surprised, and I really thought to myself, these issues need to be publicized. Women need to know about this. And then the other thing I really wanted to share was as I did the research to see if there was research behind some of the conclusions I was drawing. And there was a tremendous amount of research. And now there was even more information out there that women
Mhm.
didn't know. And I think that it's important to know everything you can about how the system treats women, sometimes well, sometimes not so good. And I think it's important so that you go in with your eyes open. So many of the
Mhm.
women said to me, well, my doctor knows best. And that frequently they do, and sometimes they don't. And you need to know about that.
Absolutely, absolutely. And sometimes just getting a second opinion and whether that it,
Absolutely.
like, yeah, yeah, did you find there's a hesitation? Like, is it that they're embarrassed, they don't want to offend the doctor, or what were the
Exactly.
reasons when people aren't
Well,
getting a second opinion?
they don't want to hurt the doctor's feelings. They didn't want to be rude. They didn't want to be labeled a difficult patient. In fact, one woman said she would never get a second opinion. She was afraid it would go on her chart and follow her, throughout her medical
Mm,
career, so to speak.
that's sad.
Women we're socialized to play nice, to take care of everybody. So we find ourselves maybe taking care of the doctor as well. We're taught not to be rude. How does that go if you can't say it with honey or don't something about vinegar and honey? But in other words, if you don't have something nice to say, don't say it. All those things. And incidentally, just so everybody out there knows, not all doctors object to you getting a second opinion. I was on a podcast with the doctor, and she said she loves it when patients get a second opinion. For one thing, it validates her or not her diagnosis, and secondly, if there's ever a medical malpractice suit, she has backup. So for
Yeah,
both reasons,
yeah,
it was she likes it. So there you go.
yeah,
Something that I never
yeah.
considered,
We
frankly.
definitely have, and it's interesting. We definitely have different, like in Canada, we have a different medical system. We don't have the
Hmm.
same issues with insurance. It's not like basic
Right,
medical care. I mean, you show
right,
up, you can be someone homeless on the street or businessman. You're going to
right.
go in, you're going to get cared for.
Yeah.
Maybe not, but it's humans that are still behind the stethoscopes and
Yes.
the doctors and
Yes.
the nurses and so forth. And there's always going to be human biases, right? So, but I know for myself within the healthcare system, within the oncology system was what my expectation was. Yeah, second opinions, sometimes just within our own clinics, like, very large clinics, or so was welcome. In fact, it's not unheard of, interesting enough, where sometimes people were like, I'm gonna go off to the States or go do something and they go and
Right. Right.
they come
Right.
back and they're like, okay, yeah, they're gonna do the same as what you're gonna do, right? So, but people, it's fine though, because it's so important that when you take a step, if you're going this medical route, and I know that many people within our fab community actually follow a lot of complementary, which
Sure.
I
Sure.
absolutely, I'm very much a both and. So that's why I'm having
Oh
this
my.
conversation. There's like when
Yeah.
we talk about, there's like, I don't really use the word alternative medicine because it's
Okay.
not an either or. It depends on
I
what you're
agree with
needing,
you.
right? Like,
Mhm. Mhm.
right? It's kind of like,
Yeah.
it's like talking about, well, do I need my shoes or do I need my hat today?
Right.
Well, the
Yes,
reality is you probably need
that's a
both, and
that's a
they
good
do different
example.
purposes,
Right.
right?
Right. No,
So
I agree
that's
with
my
you
example.
fully.
It's cold out. It's for the same situation. It's cold out. Which do I need? Well, you probably need both. But today we're
Right.
talking more about the medical system. When we need something, something's got serious enough. And I think, a second opinion can be validating. But the other
Mhm.
thing, and what I used to let my clients or patients know about is occasionally I said, the doctor's going to come in and you two are going to make a decision together. And I think this is
Mhm.
changing because I've been a nurse long enough that it used to be a little bit more, oh, the doctor knows best and everybody just did what
Right.
the doctor did.
Right.
But
It's changing
now
here
it's
too.
more, yeah, like the doctor and the nurses and healthcare professionals and, various other designations, what they're doing is they're there to consult with you to say, in
Mhm.
my best knowledge, this is what it's up to you whether you want it, right? This is what I think you
Right.
do. Now, there are
Right.
some things where across the board, it's like you ask 10 people, they're all going to give you the same answer.
Yes. Yes.
However, there's other things where it's like, well, we can come at it from this angle, we can come at it from that angle. So
Right.
now the question is, you could get 10 different opinions. Which one do
Right.
you choose? And no one is more right. It's which one is right for you. Would you agree on that?
I would agree on that, and I think that the question of which one is right for you is from my research is critical because if you're comfortable with the diagnosis and with the treatment, you're much more likely to comply and follow through with it. And compliance is a big deal.
It's
A lot
true.
of people, men and women, don't follow their doctor's
Absolutely.
instructions and can die as a
Oh, yeah.
result.
I mean, tell me if you agree on this one. I personally believe, from what I've witnessed, because you've done way more research, is I believe we use pharmaceuticals way more than needed
Me
because
too.
people don't comply with, meaning they don't follow the recommended prescription. So something as
Right.
simple as diabetes or
Right.
prediabetes or insulin resistance, if we lose 20 pounds and we actually change our eating habits
Right.
and we change our exercise habits,
Right.
we don't necessarily need to go on the hyper anti-glycemics,
Right.
right? We
Yes.
don't need to go in, we don't need to, it's phenomenal the amount of issues we have. So, like, what did you see in your research? Like, what percentage did you see of the illnesses related to stress and lifestyle? Did you see a
That's
big
always
correlation?
yes and no. And
Okay.
the reason I'm saying that, what I found, which is almost a sidebar to what you're saying, and I will get back to your question, but I found that many of the women felt very ashamed about being ill. The reason they felt so much shame, and here's where we sort of the questions come together, is they felt that they were sick because they couldn't manage their stress. And whether
Got it.
that was true or not, I had no way, nor did they, quite frankly, of evaluating. But they were sure that the reason they were ill was because their lives were out of control. These are their words, not mine.
Yeah.
And they felt that their illness was almost like a public acknowledgement. Look, world, I'm sick. Now all of you can see that I can't manage my life. And while there is
Mm,
definitely a correlation, as you well know, between stress and your immune system and illness, there is also, I mean, illness can be genetic. Illness can be, some people get COVID and some don't, and some are stressed and don't get COVID, and some aren't stressed and do, and
yes.
some alcoholics get liver disease and some don't. I mean, I could go on and on about how about
Yeah.
people who never smoke that get lung cancer. I mean, so you really can't say that this disease is my fault. I mean, and it may be. You may be overweight and you may never exercise, and that could be why you got diabetes. But on the other hand, a lot of people who do all those things get diabetes anyway. So,
Right. Right.
before you
What I'm
blame yourself,
hearing, yeah. what I'm hearing you say, though, is one of the biggest, I think, heart wrenching results of all of this is the shame that women are
Yes.
carrying around
Yes.
for being ill,
Yes.
as if,
Yes.
well, wait a minute, I can't be the sick one because I'm supposed to be the caregiver.
And that's exactly what people told me. I'm supposed to be the caregiver. I'm not supposed to receive the care. I'm supposed to give the care. And
I
that's
see that a
exactly
lot.
what, yeah, I'll bet. I'll bet.
Yeah.
Um, and
I sometimes
sometimes we
take,
all get ill,
yeah,
period.
yeah, yeah. I'll share with you a brief one. So I've taken a hard line sometimes in a sense to get somebody out of that if I have to. And if I know that they're sitting with a loving family and I can really tell that the family's being torn because this person is being so stoic and not,
Yes.
and is rejecting their support.
Mm-hmm.
I have gone so far as to look at them and say, why are you being selfish? And they're like,
Yes.
taken
Yes.
aback. They're like, what do
Yes.
you mean? And I'm like,
Yes.
well, if your daughter or I pick someone that they love, I go, if they were ill and they were rejecting all the love you want to pour on them, how would you
Mm-hmm.
feel? And then suddenly she breaks into tears and the family breaks into tears. But it was like
Right.
that eggshell that needed to be cracked open so that they could have a compassionate conversation. Where,
You're,
on one hand, when someone's not well, you need to let them do what they can for them, but you need to support them. But it still has to be within their realm. And the person that's ill needs to also
yes.
be willing to accept the support, right? So,
Right, right.
yeah, yeah.
I think one of the things, and I just want to interject this for a minute. I put together a bunch of focus groups. I mean, not for any fabulous reason except that I wanted geographic diversity. So, we got people from the north, from the northeast, and the northwest, and et cetera, et cetera. And one of the things, in fact, the thing that really surprised me the most was that almost, I won't say none, but almost none of the women had ever talked with anybody else about their illness other than their
Oh,
doctor. And that blew me away. I mean, first of all, I
wow.
tell everybody everything. I mean, you want to ask how I am, and I say, how much time do you have? But the reality is, I was shocked, and I didn't even. I had hired
Oh,
a
wow.
facilitator, and she barely was needed because everybody they were so happy to hear other women. Again, they all had different diseases, but they were so happy
Yeah.
to hear that other women shared their feelings. None of them had allowed themselves to gain support or to be supported. And that really did
Oh,
surprise me. That was probably the most shocking thing that I came across. That and the shame.
that
Those were
breaks
the
my
two things.
heart. That really
It did
does.
my
That
it did
is,
mine too.
oh, yeah,
It
yeah.
did mine
Well,
too.
and that's what it does is also, I'm just going to put a little plug in here for things like what you're doing and what Fabulous at 50 stands for. And I know some other really amazing women's organizations out there where if you are a woman and you are feeling like you are alone and are you not being heard and you want a safe space, that's why we have the Fab Soul Sisterhood, the Fab Soul Circle group, so that we
Right.
can come
Right.
together. We focus on building each other up in the joyful side. But every once in a while, it's like, if you have something going on, you have a safe place where you can share it and you're going to be supported. Right. So I
And I want
imagine
to
that's
just
what came out of it.
I want to add to that because I mean, I agree. It's not 100%, but 1,000%. But I think that
Mm,
when you withhold how you're really doing, when people say to you, and I don't mean in a cocktail party, obviously, but when people
yes.
say to you, how are you doing? And you just say, fine. I think that's a selfish answer because sometimes people really want to know and
Yeah.
you're denying them the opportunity to give and you're denying yourself the opportunity to receive. And we all feel good when we give to other people. So if you blow me off and tell me you're just fine, you're hurting me in a certain sense. It's
Yeah. Interesting.
Yeah,
Right.
I really feel that very strongly, and I've
Yeah.
observed
No,
it.
I
I
can
mean, I
see
really
that. I
did.
can tell.
Yeah.
And I love what you're doing. So I have two, three more questions before we'll get close to winding up. My one question right now is, if you could, for somebody that's never heard of the book and might be interested in reading it, can you just give them a summary, like once they've read this book, what will they get out of this book? What will
That's a
it share
great
with them?
question. Nobody's asked me that before, and I really like that. A couple of
Mhm.
things. You'll learn to I hope, I'm going to say, I hope you'll learn to put yourself first. Not only will you learn the benefits of second opinions, but you'll learn how to get them. There are certain methods that I think will work the best for you, no matter who you are or where you are. Third, you'll learn how to communicate with your doctor a little more effectively and how to take in, you've got to go in with a list and a written list of your symptoms and
Yes.
how to do your research. And
Yeah.
the communication's is very, very important. And I think the other thing you'll learn is how to do your research. And I think that doing your own research is critical. Um, Let me tell you about my thumb story because it illustrates truly the importance of research, which is I'm one of those lucky women that have never had pain. So one morning I wake up and my thumb hurts.
Uh-oh.
Oh, you're
You're really lucky not having pain, by the
Oh,
way.
I know.
I'm
I couldn't
jealous.
read it. Okay. So I've never had pain, or very rarely. And so one morning I wake up and my thumb hurts. And I thought, Sue, you're 80 at the time. Now I'm 81, but at the time I was 80. And I thought, stuff happens. But a month or so later, it was still hurting. And because I'm a little neurotic about illness, I thought I had bone cancer. So I ran to the doctor. I went to a rheumatologist just in case, hopefully that, I figured she'd know bone cancer if she saw it. Anyway, she did an x-ray and sure enough, I did have arthritis. And so she recommended a particular medication and I'm on Lexapro for depression. And so I said, is this medication going to interfere with the Lexapro at all? And she said, no, not in the least. Don't worry. So I, happily go home. But because I wrote this book and I thought, put your money where your mouth is, I better do what I say.
Yeah,
So I went
practice
and
what you preach.
it's the truth, really. So I thought, well, I'll look it up. And I looked it up, and she was mostly right. I mean, 99% of the people have no issue, but the other 1% get a brain bleed. Well, now this was a thumb that I hadn't even taken a Tylenol for, and I was not willing to risk a brain bleed. I mean, it was just not going to happen. So I didn't, I mean, I actually threw out the medication. But my point is, she didn't tell, she was right mostly, but she did not tell me all of the benefits and all of the risks. She only told me the benefits, a few of the benefits. And I think it's so important to do your own research because the doctor wants you to follow their prescription, and you can back me up on this or not. And so they may be less likely to tell you all of the risks. I don't know that I would really tell somebody about a 1% chance unless you're the 1%. Then it's a
Yeah.
little tricky.
Yeah.
So,
Yeah. 1% is still, I get what you're saying. And I think this begs to highlight the importance of multidisciplinary support in healthcare.
hmm
So
hmm
it is not, doctors are not pharmacists, right? Like they're doctors,
right,
they know about all this. But for me, and certainly within Canada, like our tendency is the doctor prescribes this to the best of their knowledge that these medications are okay, but
right.
it's always with that caveat, check with your pharmacist. And so all
Yes,
the pharmacists, at
yes,
least in the province I'm in, different provinces, we have healthcare per province, not per
yeah. I
federal.
see. Oh, I see.
And yeah, so each province takes care of it. And within Alberta, where I am, you can bring up all the pharmacy. It doesn't matter which pharmacy you go to, it's all connected. So
I
because
see.
there was accidental stuff that you got a drug from this pharmacy and a drug from that pharmacy, and if you're not
Sure.
telling, sometimes people don't tell the doctor what drugs they're still taking from a different
I know.
doctor. So it's the pharmacist's job when they give you a new prescription to screen whether or not there's any interactions. So,
Right.
but you yourself as the patient, as the client needs to really look at that. So,
Yeah. Yeah.
I would put out there kind of on your behalf, saying when you're talking about educate yourself and research, is your research could simply be going to the pharmacist and saying, I have all these different medications,
Yes.
or the
Yes.
doctor started me on this one, but I have this one from a different doctor. Should I still be taking them? And your pharmacist can be a really good advocate to be able to even reach out and go, you don't need to be taking all of these. You need to be maybe down to these three, and they can communicate with the doctor as well. So
Right.
I think the biggest thing that I'm hearing here is advocacy. The other thing I heard
Yes.
is when you
Yes.
were talking about your book and what your book can do, it can help you as an individual. But if you're well, but you're taking care of your mom, or you're taking care of your auntie or somebody else,
Right.
this
Right.
book is helpful, because even if you're
Yes.
being an advocate for somebody else, the biggest thing that I'm taking away is be educated and know that you have choices. And so before we wind up, because I can't believe our time is coming to an end here, we could just talk. I think we could talk for
It's
another
true.
hour.
I
But
do
I'd
too.
always love to end every episode with some tips of wisdom. So, Susan, what would be your sort of 3 tips? I'm choosing a number. You can do
I
more if
think
you
my
want.
first one is exactly what you said. Be sure you advocate for yourself. You've only got one body and it's yours. And your job really is to take the best care of it that you can and to make sure that you get the most effective health care that you can. And that
Yeah.
really involves listing your symptoms so that you're clear about what they are when you go to the doctor. It involves, for example, repeating back what you hear the doctor say. One thing I didn't even get to mention is that 85% of women leave the doctor's office without fully understanding what they've been told. And that's horrifying. So if you repeat back
What's
what you say,
tell me that
80,
statistic?
85,
85%.
well, right, 85% don't fully let
Horrible.
me put it the other way. Only 15% of women will tell the doctor that they don't understand something. But that means that 85% don't. And that's horrifying because you really need to have a full understanding of what you have, why you've been prescribed, why your treatment is what it is. So if you repeat back what you heard the doctor say, that gives you a chance to be sure you heard correctly. It gives the doctor a chance to confirm or correct anything that you may have misheard, or maybe the doctor misspoke. We all do. They may not have said what they thought they were saying. So it's really a good practice to do that. And I also,
That is
another
such
thing
wise advice.
I think so. I mean, truly, I do. And the
Yeah.
third thing that and this is, these are all tips, I guess it's kind of an answer to your question, is
Yeah.
besides do your own research, but try to take somebody with you so that you can hear.
Yes.
Four ears are better than two. And if you're like me, you get so anxious. I don't always hear. I always I used to take my husband, or now I take my kids, whatever. I think it's a really important thing to do. But
Oh, it's
the
so
party,
important.
yes, I
Yeah.
was just going to say the
And
party message.
healthcare sorry, professionals, at least within the area I worked, especially if they're going to be delivering some unfortunate news, they want somebody
Right,
there. It would be like,
right,
didn't you bring someone? We want someone to know. And
right,
especially when we're
right.
talking about, like, there's a difference between you're going for a quick checkup, like I have a sore
Yes,
throat.
yes,
Yes, you have that.
right,
But when
right,
you're
right,
going for some big stuff and you're seeing a specialist, you want to
right,
go, you want to know your options. I don't know what it's like there, but our practice, it was that as long as you ask permission first, you don't just do a secret recording, but if you
right,
ask uh, permission first, many doctors will happily say, yes, you can record so that you
right,
can listen, because they know when the minute they say you have XYZ diagnosis, and it's
right.
something
Yes.
that's serious, boom, that's gone. In fact, I would start every one of my, when I bring a patient into the room, I would say, just so you know, we are aware that you will probably retain 10% of what is said today. So
Right,
that
right,
do not
exactly,
be
exactly.
scared about asking questions. But unless the healthcare professional prefaces it that way,
Yes,
unless they
right.
set the tone, I think it's really important. There's a lot of healthcare professionals out there that they're so rushed and they're so busy, they're just kind of in there doing
Yes,
their thing. And
yes,
we've lost a lot of that ability to share the compassion we want, to say, hey, we get what you're going through.
right,
We're here to hold your hand and help you. Right. So
right. No,
I
I think
really
that's so
love,
important.
yeah, I love that your book sounds like it really is inspiring women and empowering women to be
I
more
hope so.
proactive in their health.
Very much so. That is my
Yeah.
hope and my goal. Or it was my
Amazing.
goal and it is my hope.
Yeah.
So,
Now here's a question you weren't expecting. So I'm going to put you on the spot.
okay.
What's next? Do you have a different
Oh,
project? Where are you headed with all of this?
Well, I'm writing book two as we speak, and it's
Okay.
really about gaslighting that women in the United States, in particular, I don't know about Canada, often feel dismissed, ignored, brushed off. Um, and so I'm writing about that. I've started with people, women who have heart attacks, and how they, even if they go to the emergency room with the same symptoms as the man, they wait longer to be treated, et cetera, et cetera.
Yeah.
Um, so I mean, it's really important. Um,
Absolutely. Well, what often happens is even that's where they go the same is women have different symptoms, but there has not been as much study or research for women. So
right, right.
that we're going to go down a whole new rabbit hole. We're going
It's
down.
true.
We're
It's
not going to do that today. We're focusing on the book called Sideline. So please check your show notes. You've been here
Thank you.
listening to Susan Salenger, who is just a powerhouse of a woman who is stepping up, using her own experience and her own voice to be able to advocate for other women. And so, Susan, I
Great.
so appreciate you and the work you're
Thank
doing.
you.
And I'm going to earmark when that next book comes on.
I'll let
I
you know.
absolutely, you be in touch. I want to get you back on the show so we can talk about
Lovely.
gaslight, because I don't think there's a woman listening today that doesn't know the feeling at some point in time in her life
Yes.
of being gaslighted.
Right.
And
Right.
I know it happened to me lots before I even knew what the term was. Once I heard
Sure.
the
Me
term, I
too.
went,
I only
"Oh
heard.
my word! Like that's incredible."
Well,
So
thank you
thank you.
very much. But
All
thank you
right,
for having me. I really appreciated it.
that's
Or appreciate
wonderful.
it, no past tense.
Take
Thanks
care. Bye
again.
bye. Take care,
Bye
everyone.
bye.
Thank you so much for tuning in today. But before you leave, I'm curious. What pearl of wisdom are you taking away from today's episode? I do hope it held some inspiration or information for you to live your best life. If you are not yet part of our sisterhood, I invite you to join our community by visiting our website, fabulous@50.com, and you'll receive a free copy of our ebook, Make Mine Fabulous, 21 Ways to Energize Your Life. It is packed with loads of tips and tricks. Plus, if you haven't already done so, please subscribe to this podcast and leave us a review to let us know what you think. Remember, keep choosing fabulous. It's never too late to live the life you deserve. Catch you on the next episode.